Hi everyone, welcome back to Complete Physical Education, your go-to spot for videos related to sports as well as physical education. I'm Chinmay Jalmi, and today let us break down a powerful recovery technique used by therapists as well as athletes worldwide, the contrast bath. So what exactly is a contrast bath? Scientifically, it is a form of hydrotherapy wherein you alternate between immersing the affected body part like your hand or your leg from hot to cold water. This isn't just for feeling good, it is also more about the physiological changes happening in our blood vessels. So now let us learn what all we need to conduct a contrast bath. First of all, we will require 2 buckets, hot water, cold water and a timer. In this case, I have used the red bucket in which there is hot water which is approximately 37 to 40 degrees Celsius, and I have used a blue bucket in which there is cold water which is approximately 10 to 15 degrees Celsius. Before we start, let us see who should and who should not perform contrast bath. First of all, if you have any kind of muscle soreness or stiffness, as well as if you have any kind of joint pain, you can perform contrast bath. But then if you have any kind of open wound or infection, as well as if you have poor blood flow, you should not be performing contrast bath. So now let us start with the execution of the contrast bath. First of all, I have to dip my affected part. In this case, it is my wrist of my right hand into the hot water. Once I dip it into the hot water, I need to keep it for 3 minutes. So let us start. As soon as I dip my hand into the hot water, I need to start the timer. My hand needs to be in the hot water for approximately 3 to 4 minutes. Now I won't keep it in the hot water for obvious reasons, but then once the 4-minute timer is up, I need to quickly alternate between hot water. Now I have to alternate into the cold water, and I have to keep my hand in the cold water for approximately 1 minute. Once 1 minute is up, I need to again alternate to hot water. Once I alternate between these 2 buckets, it completes 1 cycle. Lastly, in order to get the best results out of the contrast bath, we need to complete at least 3 to 4 cycles. So now let us learn the science behind the contrast bath. First of all, when I dip my hand into the red bucket, that is the hot water, my blood vessels widen. This process is called as vasodilation. In this process, the amount of blood reaching to my affected part increases. This also increases the amount of nutrients and oxygen reaching towards my affected part. Now, when I alternate into the cold water, my blood vessels narrow down. This process is called as vasoconstriction. This process helps in decreasing inflammation, wherein the amount of blood reaching towards my affected part decreases, and also helps in flushing out waste. Lastly, when I alternate between vasodilation and vasoconstriction, there is a pumping effect that is formed in my blood vessels, which helps in decreasing swelling and inflammation and helps in faster recovery. So that was the science behind the contrast bath. By harnessing vasodilation and vasoconstriction, one can boost their circulation, flush out toxin, and that can help them to recover faster. If you are an athlete or you just want to bounce back from a tough workout, you can give contrast bath a try. I hope you found this video helpful. Smash that like button, subscribe for more science-based recovery tips, and lastly, if you have any questions, you can drop them in the comment section. Thanks for watching Complete Physical Education. Stay smart, stay strong, and I'll see you next time.